Immediate SatinSheet system reduces friction between the user and the bed. It reduces shear as well, and thereby the risk of pressure sores. The SatinSheet 2-direction comes in 3 different versions: Maxi, Midi, and Mini. The system classifies users into 3 different categories: independent user, partly dependent user, and dependent user. In this case, a SatinSheet Mini helps a user to stay independent. The 2-direction Maxi corner is easy to attach to the mattress. The low-friction satin material makes it easier for the user to move independently. The combination of a 2-direction sheet with a draw sheet facilitates lateral movement and turning in bed. The unique quality of the SatinSheet material reduces movement down in bed. The striped cotton material on the sides will break movement and reduce the risk for the patient to slide out of the bed. When the user is partly dependent and needs to be turned in bed, use the draw sheet to center the user in the bed. Grasp the draw sheet and pull the user gently towards you. If possible, ask the user to cross their arm toward the opposite side of the bed. In the same movement, turn the user on their side using the draw sheet. Remember to use your legs to ease the working load on your arms, shoulders, neck, and back. The Immediate SatinSheet 4-direction draw sheet reduces the friction in all 4 directions. The dependent user needs help for all repositioning in bed. The SatinSheet 4-direction system is used to reduce the workload on the caregiver. Put down the bed rails on both sides. Two caregivers can easily move the user higher in bed by pulling the Immediate SatinSheet 4-direction draw sheet simultaneously. Both caregivers are positioned close to the bed with their nose, torso, knees and toes in the same direction to prevent a rotated back spine. When the user needs to be turned in bed, position the user closer to the bedside. If possible, ask the user to cross their arm toward the opposite side of the bed. Assist the user if needed. Use the SatinSheet 4-direction draw sheet to position the user on their side. If the user has to stay in this position, use a positioning wedge or a pillow behind the user for support.